Heather McCoy behind me, she's a rock star in headache medicine. She's Dr. Headache McCoy. She was graduated from the first doctoral program for DNPs in the country from Columbia a few years ago. And she owns her own headache center in Scottsdale, Arizona. And I think the Mayo Clinic sends you some patients, and she gets patients from Barrows, it's called, yes. And she gets patients from everywhere. I think she's seeing about 20 patients a day. She's doing procedures. She's Edwards Scissorhands. She doesn't give Dilaudid or Demerol. And the funny fact about Heather is she's a lot like me, but she is into motorcycle riding, and she has a Ducati. I don't even know what that is, but it's like something special. A Ducati? Oh, yeah. Okay. Okay, got it.
I'm going to talk to you this morning about neuromodulation devices. This is kind of a pivot from what we've covered for the last 2 days, but it's a really interesting part of headache medicine. There's only a few of them available right now, and I'm only going to talk about the ones that are available to us to use with our patients. These are external handheld devices that enhance or suppress the activity of the nervous system. And we're talking mainly the trigeminal nerve, the occipital nerve, and vagus nerves. And they work by diverting, one of them works by diverting peripheral pain. Oops. There's a lot to like about these devices. They're easy to use, they're easy to start, they're easy to initiate and discontinue. There's few, if any, side effects at all, and that resonates with a lot of patients. There is no risk of medication overuse with these devices. They're not addictive. They do, I will tell you this, when you have a migraine, they feel really good. And they offer your patients an FDA-approved treatment that's based on rigorous allopathic standards. So there's not a lot of woo-woo in these devices. There is solid science behind these devices. And so for your patients who, I get a lot of patients who, one of the first things they'll tell me is, I want to stay away from medicine. And it makes it very difficult. I have to, why are you here if you, but this is a branch of medicine that we can offer patients who want an alternative, and there's good evidence behind them. The downside is they're expensive, and they're hard to get covered by insurance companies, most of them. Some of them have better coverage than others. Some of them, or one of them you'll see, that's not going to be an issue for us. And for some of them, again, probably most of them, but not all of them, the marketing strategies are cumbersome. They want me to send in a prescription, and then the patient has to place an order online, and then the patient has to get called back, and they get refilled with a card that's expensive, and it's just the whole process of getting these into your patient's hands is cumbersome. So I think that holds back a lot of the access. The first one I want to talk about is one of the oldest. This is the Cephali device, and it's a little tiny device that weighs virtually nothing. It's attached right over the trigeminal nerve there in between the brows, and patients wear it. It works by transcutaneous electrical nerve stimulation, and it emits a very low frequency sort of buzzing sensation. And there are two ways to use it: either for acute treatment to stop a migraine in progress, and by doing so it emits a high frequency single long session. It is rather sedating. A lot of patients like it because it helps them go to sleep. There is a prevention setting, which is fairly new. This emits a low frequency daily short sessions that seems to improve migraine triggering thresholds. we're really not sure exactly how any of these devices work, and that's the same with Cephali, even though it's been out for quite some time. But we do know that there's metabolic activity of the orbital frontal and rostral anterior cingulate cortices, which are pivotal areas in central pain and behavior control. And it's decreased in patients with migraine. And in this, Magis et al. A couple years ago in Cephalgia published a really nice paper that showed that hypoactivity is altered with regular use of this nerve stimulator. It's very safe. The most common side effect is that patients didn't like it. It does cause some drowsiness. The most severe side effect that was identified was an allergic reaction to the electrode that it's an adhesive that holds the device on. And it is safe to use in pregnancy, so that's a nice option to be able to give patients. There are 3 devices available, and again, I find this a little cumbersome. There is a single device that's only used for stopping an acute migraine. There's a device that's only used for the daily preventative, or there's one that does both. And I don't understand why it's like too many choices in my opinion, but that may have something to do with the developmental process. They first started with the acute device. But they are a single purchase item. They're not cheap, but if it's a single purchase that you're not having to refill and recharge, there's that. They do offer a 60-day return policy. You get your money back after 60 days, which I like that. To me, as a consumer, that shows me that somebody believes in that product, and that's pretty low risk. In certain parts of the country, you can buy these over the counter, but in the United States, it does require a prescription, and this is the one that the prescriber has to prescribe it by just faxing to the cephali.us or wherever you're practicing, and then the patient has to go online and place an order, and then they match the order with your prescription, and then the company calls the patient, and for a single purchase, it should just be on your shelf or someplace where they can just order it and have it sent. But anyway, that's the Cephali device. For your patients who are electromagnetic sensitive, this is not something to be concerned about. It emits an electromagnetic field it's about 1/10 of what a hairdryer or an electric shaver. But I know you're seeing, I get these patients, I know you're gonna get them too, so now you know. The next device that I wanna introduce you to is the eNeura Spring Tms Mini. And I like this picture because you can actually see what the thing looks like, and you get an idea of its size and compared to other well-known items. The Spring TMS is what we usually refer to that as. The indications are for migraine, acute treatment and prevention, ages 12 and up, so this is something to consider for adolescent patients. It's particularly good for migraine with aura. It works by emitting a single pulse transcranial magnetic stimulation. It's just one single pulse. The Spring TMS raises the threshold for cortical spreading depression and modulates activity of nociceptive thalamic trigeminovascular neurons. And it's very easy to use. Power it on, place it over the back of your head. It's right over the occipital nerves. And then with a single press of your thumb, it emits a very low magnetic pulse, just one pulse. This is how it comes. It's a battery-charged, rechargeable device. It is refilled with a SIM card that's mailed to you monthly, or mailed to the patient. And that's the refill of the prescription, is a loaded SIM card. Dr. Hawker at the Mayo Clinic in Scottsdale demonstrated in a recent article that the use of the single pulse TMS to treat migraine with medication overuse. So there may be some new implications for this device and others using it on non-migraine diagnoses. The ESPOUSE trial was that was a very recent study that using the Spring TMS in a multi-center open label study with pretty big numbers, 3 months of treatment consisting of preventative plus four pulses twice a day and acute treatment could be beneficial for patients. And the results were pretty impressive. 46% of patients reported at least a 50% reduction in mean migraine days. And the Spring TMS might be an effective strategy for migraine prevention. Again, it's important to stress, I think, the reassuring side effect profile and the lack of contraindications on these products. So while they may be cumbersome, they may be expensive, the value is, they don't have side effects, and they're very safe to use. The next device is the GammaCore device. It's an external vagus nerve stimulator, non-invasive. We've had internal vagal stimulators, of course, for a long time for things like seizures and depression. And so this is completely handheld, external. It's indicated for the acute treatment of episodic cluster headache and the acute and preventative treatment now of migraine. But it was first approved in the use of cluster headache. So how does the GammaCore work? GammaCore transfers electrical impulses transcutaneously to the cervical branch of the vagus nerve. The vagus nerve runs along the neck. If you feel where your carotid notch is, just to the just lateral of the midline here, there's a little notch, and you can place your fingers over it right where you feel your pulse, and your carotid or your vagus nerve runs right alongside there. So it's very easy to locate. It's very easy to treat precisely. My roommate last night has one, and I used it for my migraine, and I'm telling you, when you have a migraine, like I said in the beginning, these devices feel very good. It delivers immediate relief when it works. It doesn't work for everybody, but when it does, it's really nice. This is the device. There was an older version of the device that was a little bit bigger and a little bit clunkier, but this is their new sleek device. It's called the GammaCore Sapphire, which I thought was interesting because there's nothing sapphire about it. I don't know why sapphire. It delivers an acute nociceptive activation of the trigeminal autonomic pathway and significantly inhibits responses of trigeminal cervical neurons. Dr. Silberstein published a nice paper with a study looking at patients who treated regularly and demonstrated at 15 minutes a pretty impressive pain relief for patients with episodic cluster headache, and pretty quickly. And again, when we see these devices, we pick them up and we look at them and we touch them and we turn them on and we try them. But when you have a process going on, it's I experienced at least immediate relief. But for cluster headache, 15 minutes is pretty fast relief. The GammaCore should not be used in patients with any hardware in the vicinity of where you're applying the device. So they shouldn't be used for patients with pacemakers or loop recorders. Those are somewhat distal, but close enough to be avoided. Any stents, carotid stents, plates, screws in the neck. So anybody who's had cervical surgery, I'm automatically, and this device is not for you. And anybody with clinically significant carotid plaque, there's a theoretical risk. There was nothing that was demonstrated in clinical trials for this device. But the presumption is if you've got clinically significant plaque in the carotid artery and you're delivering a magnetic impulse that might jar something loose. That's the implication. So nobody with clinically significant plaque gets this from me. It is not FDA cleared in pregnancy. It is not FDA cleared in pediatrics. Patients should not use this while using other electronic devices and like a cell phone, and so it should not be used while you're texting other ambassadors about national security issues. It's a prescription-only device. The device arrives fully loaded for 31 days of use. There is a finite number of doses per day that it will deliver, and I don't remember what that number is, but it's just so high that nobody could use them up. And some patients will because they like the way it feels. It is refilled with a SIM card. So however often you use it's good for 31 days, and it's that the clock starts ticking the first time you use the device. So again, for patients with cluster headache who may not have another attack for a long, long time, it's a cumbersome sort of strategy, in my opinion, and it's not inexpensive. It ends up being about $500 a month with that to refill, and coverage has been disappointing. Although I will say for patients with TRICARE, it's covered with a $30 copay. So I hope that catches on. It's a very, very good device that's easy to use and can be very effective. And so we're hoping that other payers come around. Again, they have a very robust introductory program, and the marketing strategies change frequently. So I think there's some new sort of program coming out for this device where patients can get it as long as a prior authorization is on file. They end up getting it for extended period of time for either free or very little, something similar to the way the CGRP savings programs have been going on. But I don't know. There's these things change faster than I can keep up with. The last device that I want to talk about is hopefully something that you've all had a chance to see in the exhibit hall. It's the Neurivio. There's a picture of the devices on the bottom of the picture there, and yes, that's a cell phone. The Neurivio is a brand new device that's available. It is a wearable, battery-powered medical device for the acute treatment of migraine. The intensity of the stimulus is controlled with an app on a smartphone. It's either Android or iPhone friendly, but it's got to be a smartphone. And that app also has a really interesting feature that it acts as a migraine tracker. So it will track your headache history, how long it lasts, when did it start, possible triggers, and that's all retrievable to share with your clinician. So I kind of like that. But the app feature is something that I think will resonate with a large population of our patients. So how does it work? The Neurivio works by remote electrical neuromodulation. It stimulates an upper arm peripheral nerve to induce conditioned pain modulation, which is something that our bodies do on their own. It's an endogenous analgesic mechanism by which conditioning stimulation inhibits pain in remote body regions. So it delivers a noxious stimulus to your arm. I'm doing the gesture here like you all know what I'm signaling, but it's worn on the bicep. And by delivering a noxious stimuli, it's not a painful stimuli, it's just a weird stimuli, it can stop your mind, it can stop a central pain mechanism. Stimulates nociceptive sensory fibers of the upper arm above their depolarization thresholds, but below the perceived pain threshold. And that results in the activating the ascending pathway. It goes to the brainstem, activates the descending pain inhibitory pathway and brainstem pain regulation center, to release serotonin and norepinephrine and pain inhibition at the trigeminal cervical complex, right where migraine occurs. The response at 2 hours post-treatment is very impressive. 66 almost 70% of patients reported pain freedom at 2 hours. Also impressive, the most bothersome symptom relief was also improved. So it's not just the nociceptive quality of migraine, but the most bothersome symptom, which is typically nausea, but I'm not sure exactly what it was in this study. But almost 50% of patients had relief from that as well. Adverse events were pretty minimal. Muscle spasm, I got to experience this. This was really interesting, but with the device on, instructions are to dial up with the app on your phone, dial it up to something that you interpret as painful, and then dial it back to where it's not painful. And so I kept going higher and higher, and then it just started to flex my arm, which was really an unusual feeling. Tingling sensation, some other somatic complaints that were pretty minimal, less than 1%. A sensation of warmth was just barely over that amount. Some redness, it does stick on your arm with a patch sort of thing. Should not be used by people with congestive heart failure or severe cardiac or cerebrovascular disease or uncontrolled epilepsy. And it shouldn't be used by people with an active implantable medical device, such as a pacemaker, hearing aid implant, or other electrical type device. And I uploaded a video from their website because their website is excellent. It's very patient friendly, provides a lot of information in kind of a simple way.
Neuromodulation. This video demonstrates how to treat a migraine headache with the device. For effective results, the treatment should be initiated as early as possible and always within 60 minutes of migraine headache or aura onset. To get started, download and install the Neuromodulation app from the App Store or Google Play. Open the app and sign in or create an account. Enable Bluetooth on your phone, which can be found in the settings on your phone. Turn on the device. A slow flashing green light indicates the device is on. Place the device in proximity to your smartphone. Connect the device to the app using the app instructions on your screen. The device should now be connected to the app. In the treatment screen, a connected status will be displayed, as well as the remaining number of treatments. If the device disconnects from the app will display a disconnected status. When the device is on and the app is opened, the device and the app should reconnect automatically. You can also press the Connect Neuromodulation button. Carefully remove the protective film from the electrodes and save it for storing the device and maintaining the electrode adhesiveness between treatments. Place the device on your upper arm so that the electrodes are in contact with your skin and the LED facing outward. The device should be located midway between the elbow and the shoulder. Use the armband to secure the device in its position and to improve the contact between the device and your skin. To do so, adjust the armband to your size. There are 4 sizes you can choose from: small, medium, large, or extra large. Attach the extension to the armband for large and extra large sizes. Insert the strap to the buckle of your size. Wrap the armband around the device on your arm and fasten the strap. The armband will improve the contact between the device and your skin. If the armband does not fit your arm, repeat this process to find your size. In the treatment screen of the app, click on Start. For effective and convenient treatment, set the treatment intensity level so it feels strong yet comfortable and not painful. To do so, gradually increase the stimulation intensity using the plus button. If the stimulation feels uncomfortable, decrease the intensity to the previous level using the minus button. For your safety, the intensity will increase slowly. This gradual increase will be presented in the app by a flashing increasing indication that will stop once the desired intensity is reached. After the start of the treatment, optional migraine diary questions will appear on the screen. Your answers will be recorded to your personal and private migraine diary that is protected by your Neurivio account credentials. Simply touch the Skip option if you do not want to track your migraines. Once a treatment starts, the device delivers electrical pulses through your skin. The electrical pulses are received by several types of nerve fibers located under your skin. The treatment lasts for 45 minutes, during which you can carry on with your daily routine. It is recommended that an intensity level that feels strong but not painful will be used throughout the entire treatment session. At any point in time, if you feel uncomfortable or want to stop the treatment for any reason, you can click on the Pause button and then stop the treatment. You can also pause the treatment for 5 minutes. Once the treatment is over, remove the device from your arm and place the protective film on the electrodes for storage until the next use. Return the device to the original package or the travel bag.
So I love that it comes with a travel bag. No, just kidding. So I didn't. That was my last slide. Thank you for letting me upload the video. But that device it has a very another really appealing feature in that the price point is really attractive. So the device gives you 12 uses, and it costs $99. It's not something that you submit to insurance. It's just a purchase product. That ends up being just under $9 per treatment, which is cheaper than a lot of triptans. And again, no side effects. I think I'm really excited to see how this product does with my patients. I've already started prescribing it. It is a prescription, but it's not even a cumbersome prescription. You have a form that my office staff pre-fills out. I sign it and fax it, and that's it. That's everything is. That's the only thing you need to do. And I do believe that the first device is free or for patients. At least now it is. So without any side effects and a price point that's decent, I think it's going to be a really popular product. But I also think that there's a significant population of patients who will resonate with the fact that it uses an endogenous pain relief method. You know, it stimulates something that your body does by itself to control pain. So really looking forward to using that device. And the device folks are here. If you haven't met them already, they're still here today in the back of the room. So raise your hand so they can